Hi everyone, today I'm going to talk about Gaucher disease, which is an important topic within the field of inborn errors of metabolism and lysosomal storage disorders. This condition is named after French physician Philippe Charles Ernest Gaucher, who first described it in 1882. Gaucher disease occurrence is especially high among people of Ashkenazi or Eastern European Jewish people. In this population, about 6% are carrier of the gene mutation, which is much higher than in the general non-Jewish population, where only about 0.7% are carriers. Because of this higher rate, screening plays an important role in identifying individuals at risk. Gaucher disease is an autosomal recessive inborn error of metabolism. Inborn errors of metabolism are rare genetic conditions in which a defect in an enzyme or transport protein prevents the body from properly converting food into usable energy. Gaucher disease results from specific mutations in a gene called GBA1. These mutations cause a deficiency of lysosomal enzyme called beta-glucocerebrosidase. This enzyme is needed to break down a lipid called glucocerebroside. When the enzyme is deficient, glucocerebroside builds up to toxic levels inside many cells, especially inside macrophages. When macrophages are filled with this lipid, they are called Gaucher cells. This is an example of a toxic accumulation disorder that leads to harmful effects in the tissues where the buildup occurs. There are 5 known forms of Gaucher disease, and they are categorized based on severity, symptoms, and whether the nervous system is affected. Type 1 is called non-neuropathic type. It is the most common form and shows a wide range of symptoms. Some people may have no symptoms at all, while others may develop severe symptoms during childhood. This form does not normally involve the central nervous system. Type 2 is called acute neuropathic type. It is rare, very severe, and progresses rapidly. It appears in infancy and usually leads to death in the newborn period in infancy. Symptoms include convulsions, increased muscle tone, and episodes where breathing stops. Type 3 is called the chronic neuropathic type. It is rare and milder than type 2. Symptoms usually begin in childhood or adolescence. This type does affect the central nervous system and may cause myoclonus seizures and cognitive decline. Life expectancy is usually reduced, often into early or mid-adulthood. Also, there is perinatal legal type, and it is the most severe and the rarest of all. Symptoms may appear even before birth. The outlook is extremely poor, and most infants do not survive beyond early infancy. Lastly, there is cardiovascular type, which is also extremely rare. It mainly affects the heart valves and the arteries. Now, I will move on to pathophysiology and clinical features of Gaucher disease. The signs and symptoms of Gaucher disease occur because glucocerebroside-filled macrophages gradually accumulate in different tissues. The clinical features can be grouped into visceral, hematological, skeletal, and other systemic categories. Visceral features often appear early. Many patients develop hematomegaly and splenomegaly, which is an enlargement of the liver and spleen. The spleen can become extremely large. In severe cases, the spleen can grow up to 3.3 to 6.6 pounds, which is far beyond the normal size of 0.11 to 0.44 pounds. The enlarged spleen can press on the stomach and reduce appetite. Splenomegaly is usually painless, but it increases the risk of the spleen rupturing. As the spleen becomes larger, it may also become overactive, which is called hypersplenism. An overactive spleen destroys blood cells too quickly. This can lead to pancytopenia, a condition where all major blood cells types are reduced. As a result, patients may develop anemia, which causes fatigue, leukopenia, which is a low white blood cell count, neutropenia, which is a low neutrophil count that weakens the body's ability to fight bacterial infections, and thrombocytopenia, which is a low platelet count that increases the risk of bleeding. These blood-related abnormalities fall under the category of hematological symptoms as well. They contribute to fatigue, frequent infections, and an increased tendency to bleed. Skeletal involvement is also very common in Gaucher disease. Patients may develop osteopenia, which is a loss of bone density, and osteoporosis, which is more advanced bone fragility. They may experience pathological fractures as well, meaning the bones break because they are already really weak. Another serious complication is avascular necrosis. This occurs when the blood supply to parts of the bone is reduced or blocked, causing the bone tissue to die. Severe joint and bone pain is also frequent, usually affecting the hips and knees. Other symptoms can also appear. These include metabolic disturbances, yellowish-brown discoloration of the skin, and reduced sense of smell, and an increased risk of developing Parkinson's disease later in life. This increased risk is also observed in carriers of the mutation. Moving on to diagnosis and evaluation, recognizing the symptoms of Gaucher disease is very important because early diagnosis can prevent unnecessary invasive procedures such as bone marrow and liver biopsies. The gold standard diagnostic test is the measurement of glucocerebrosidase activity in white blood cells. A value less than 15% of normal activity confirms the diagnosis. Genetic testing is also used to identify specific mutations in the GBA1 gene. Among patients of Ashkenazi ancestry, 6 common mutations account for most of the disease-causing variants. Several laboratory markers can be used to monitor disease severity and response to treatment. These include angiotensin-converting enzyme, acid phosphatase, ferritin, chitotriosidase, and glucosylsphingosine. Imaging studies are also very important. MRI can detect early skeletal involvement and bone marrow infiltration, and DEXA scans are used to assess bone density and bone loss. That's it for today, and in the next video I will talk about treatment for Gaucher disease, and I hope you enjoyed this video. Like and subscribe and comment if you have any question. Thank you.